EMTALA is a federal law that requires hospital or emergency departments to medically screen every patient who seeks emergency care and to stabilize or transfer those with medical emergencies, regardless of health insurance status or ability to pay. This law has been an unfunded mandate since it was enacted in 1986. In this training video, you will learn possible violations of EMTALA, as well as how to prevent them in your own emergency department.
Two. Yes, I have symptoms that include runny nose, itchy throat, itchy eyes, and I have a chronic cold.
Go ahead and fill this out for me and give me your insurance, please.
Hey there, I need some help. I'm pregnant and having contractions.
All right, yes, ma'am. First thing I'm gonna need you to fill this paperwork out.
No, I don't have time. I need to get seen now.
Ma'am, I really want to get you seen, but we need to get your insurance first.
I don't have time to fill out my insurance. I need to be seen now.
Well, that's something we gotta
I don't have time to fill out insurance. I need to be seen now. Here's my insurance card. Just take it. I'm ready.
All right, we'll get you seen shortly. Dr. Kidd, can I see you at the front, please?
Yes, you called for me? Okay, we don't really need to worry about paperwork. Where's the patient?
She's up front. She's still waiting.
Can you tell? All right, ma'am, what's wrong with you?
I'm pregnant and I think I'm having contractions.
Okay, how far along are you?
They're about 3 minutes apart.
Okay, I'm gonna get someone to bring us a chair and we'll be right with you. Okay, so how far along are you?
I'm about 8 months.
Okay, have you had any complications with this pregnancy so far?
Not so far.
Okay. So how long have you been timing your contractions? How far apart are they?
About 3 minutes.
Okay. Oh, hold on just a second.
This patient here, she's outside of the insurance coverage right now. So.
Okay. Well, this is the only room we have available. Do we have any other patients outside waiting?
We have one that's showing cold symptoms.
Okay. Well, we have to wait on seeing him. This lady needs to be treated first. So if you'll just take care of him and tell him we'll be with him in just a moment. I'm gonna get her stable and then we'll take care of him. Okay. Looks here like your blood pressure is a little elevated, as to be expected. So I'm gonna get a nurse to come in here and give you some medication. Should calm down your contractions, and we're gonna evaluate you and make sure that you're not going into labor. Before we discharge you, we wanna make sure you're stable, and then there's no risk of you actually being into labor.
Okay.
Okay, does that sound good?
Good.
Okay.
Hey, sir. Unfortunately, our rooms are full. It looks like we're not gonna be able to see you today.
No, but I need to be seen today. I feel very sick, and I cannot go home unless I'm seen.
Yes, sir. Well, unfortunately, all of our rooms are full, and maybe you could check with your primary care physician.
I was able to successfully stabilize the pregnant patient. I don't see the other patient you were telling me about while we were in the room together. Did he leave?
Yes, sir. We sent him home.
Did he do it on his own or was he forced to leave?
Sir, we just told him he had to go because all of our rooms are full and we weren't going to be able to see him today.
Okay. We cannot let any patient be discharged unless we do an assessment and make sure there is no emergency. So we need to go get that patient and make sure he comes back and we can run some tests.
Yes, sir.
Excuse me, sir. Excuse me. Hi. My name's Jack Davis. I'm the healthcare administrator here at the hospital. I'm very, very sorry for the misunderstanding, but we do have a room available for you. Are you okay? Do you need any assistance? Do you need water or tissues or anything?
Tissues, a lot of tissues,
Okay.
please.
Okay, once again, I'm very sorry for the misunderstanding. If you want, you can just follow me right this way, and we can get you situated up at the front. We'll get you all squared away.
As we see in this scene, treatment cannot be delayed in order to prove insurance. And once insurance has been provided, you cannot deny treatment. If a person is outside of their coverage, you cannot give priority to another patient solely based on insurance.
Yes, last night I was.
Can someone help me? My friend's unconscious.
Excuse me, are you okay, sir? He's unconscious. What medication, do you know what medication he was
He
taking?
tried to kill himself and he overdosed.
Okay. Okay.
Is he gonna be okay?
It's too hard to tell. What's your relationship to him?
We're just friends.
Okay. What was happening right before he passed out?
I think he was trying to kill himself and he overdosed.
Does he have tendencies, suicidal tendencies?
Yeah.
Okay. Do you know what medication he might have taken?
I found this in his car.
Okay. You think he might have taken all these?
I think it was a lot.
Okay. We definitely need to stabilize him. Okay. He does seem to have a lot of damage, a lot of cuts, bruises. Was he driving or operating a vehicle at the time when
He
this
was
happened?
driving and he hit and killed a pedestrian when he went unconscious.
Okay, I'm sorry, but y'all are gonna have to find another hospital and another doctor. We don't treat patients that are killers. Sorry about that. We're gonna have to discharge
Oh,
him.
excuse me. Hi, okay, so what's going on here? Is he okay?
Yes, he's unconscious, and I was going to treat him, but then she told me that he not only has he hurt himself, but he's hurt an innocent person and killed an innocent person. So I refuse to treat this patient.
Oh, no. Okay, unfortunately, we do have to treat him. He's clearly stabilized.
Mm-hmm.
It doesn't matter. We have to treat him. This is clearly an emergency situation. He doesn't look like he's going to make it. We have to assess him. We have to fix him now.
I really don't care what the policy is. He doesn't deserve to be treated. He deserves to be arrested, and I'm gonna make sure it happens right now.
Oh, no. Okay, Dr. Kidd, can I please speak to you private over here, please, sir? Okay, look, I understand that you're frustrated with the fact that you killed somebody, and I understand that you want to call the authorities, but we have to assess this man. We have to make sure he's fixed up. I mean, we're talking a potential lawsuit.
Well, where's the justice for the other victim?
It's unfortunately, look, I just need you to focus on fixing him up right now. I will call the authorities, okay? Just please focus on fixing him up.
Are we calling him now before I treat him?
I will just focus on calling him. I'm gonna go right now to my office, call the authorities, and we'll get everything situated.
Okay. If your hospital is certified, psych patients must be stabilized, especially before being detained or sent to therapy.
I shot myself.
Ooh.
Need help.
Gunshot trauma. I can help. Here, follow me.
Alright. Oh, excuse me. Hi, okay, unfortunately, because you're just an intern here, you're not qualified to give him help. We need to get Dr. Trey out here immediately. If you, can you page him real quick after my page room?
Yeah. Paging Dr. Trey.
Okay. You see where the exit wound is and the entrance wound is? Okay. You seem to be doing a really good job. I'm really tired. I've been on call for well over 24 hours. I'm going to take a break. I know he's not completely stable, but I feel like you have no training to be able to treat him from here. So I think it's best if we transfer him in this situation. I think he'll be okay to make it to another hospital.
I think it's too risky. I don't know if he's stable enough.
Can I get your date of birth?
8297.
Okay. I'm going to set you up for a transfer to another hospital.
Okay, right. Okay, bye.
For a
Yeah,
transfer.
Dr. Kidd, can I please speak to you for a second?
Yes. I'm just transferring this patient to another
Okay.
hospital where he can be better treated.
I understand that. I just got off the phone with our other doctor. He is currently on his way. This will be your last patient for the day. I will make sure of that. I understand you're tired, but please, if you can just assess this man really quick. He needs immediate medical attention. I do have another doctor on the way, and then after this patient, he'll be good to go home.
Okay. I'll make sure he gets treated.
Okay.
According to EMTALA, patients must be seen by licensed physicians. In instances where emergency departments want to transfer a patient, the benefits must outweigh the risk of moving.
Okay, just hang on tight, sir. We're gonna get you help right away.
What's going on?
There was a bus accident. We have a severe burn victim here.
Okay. We're currently on diversion. I'm sorry. We're going to have to send him out.
Can I speak to you for a second, Dr. King?
Yes.
So we are a specialty burn hospital, so we have to take these patients.
Okay. So while she's taking care of you, there's a few things we need to make sure we get done. What need your thoughts?
We don't have time for paperwork. This is an emergency catastrophe.
Okay. Well, can I just get your ID and insurance card, and
We
that'll
don't
be
have
all.
time for paperwork.
ENT, extraocular movements are intact. Okay. Can you give me that blood pressure reading? I need to document these vital signs.
We don't have to write it down right now. It's kind of an emergency.
Okay, but we really need the vital signs. It's really important.
Okay, 180 over 60.
Okay.
Hey guys, how's it going over here? Doing all right? Okay, so due to my specific duties as a receptionist, I'm required to make sure that all of our patients are insured in order to receive treatment. Do you have any type of insurance on you today, or do you have any method of payment?
I don't have insurance or method of payment.
We're still in the process of getting him stable. Can we come back with that another time?
Unfortunately, we're gonna need we're gonna need some type of insurance or some type of payment right away due to policies and procedures.
I didn't see any signs outside about having insurance. I thought I could just walk in and get treatment.
Oh, okay. Well, here, let me tell you what, let me go check out in the lobby to see if we have any of those signs posted, because you're right, that should be posted. And as soon as I go check that out, I'll come back and let you know, okay?
I'm sorry about that.
There is a sign on the wall up there explaining the insurance.
Hey Peyton, are there any signs out here that says that patients with or without insurance can be seen?
Well, here is a sign that says that right here.
Okay, maybe we should put that on the wall, maybe staple it or post it.
It is very important to have signs posted to notify patients of their rights to a medical screening examination and medical treatment.
If your hospital is a specialty capabilities emergency department, you are required to take patients from EMTs even if on diversion. In these emergency situations, it may seem like a waste of time to fill out vital paperwork. This is important to protect your patient and protect your hospital from EMTALA lawsuits.